Good morning, everyone. This is Sandra Arevalo. I'm the Community Health and Wellness Director at Montefiore Nyack Hospital, welcoming you once again to one community chat. Today is October 13, and we're going to be talking about the sleep disorders. A lot of us have trouble with sleeping. We have trouble with our partners because they snore. We feel tired during the day because we don't sleep well. Anyway, a lot of things can go wrong at night when we're supposed to be resting and having a good time. So that's why we have Dr. Anita Bola here with us today, because she's going to talk to us about those common sleep disorders, treatments, what we can do, how to identify them. And we're very privileged to have her. So thank you, Dr. Bola. And maybe Dr. Bola, you also want to tell us a little bit of what is it that you do and where you work and all of that before we start your presentation.
Sure. Thank you, Sandra. Thanks for having me. So I'm a board certified sleep specialist, and I'm the medical director of the sleep center here at Montefiore Nyack Hospital. I've been working here since almost 2012, and I'm also part of the Highland Medical Group. I see patients in sleep consultation, and then I'm also medical director of a second sleep lab, which is up in Cornwall. It's also a Montefiore facility. It's called Montefiore Cornwall Hospital. So I work in both these places, and I see patients primarily with sleep disorders and order sleep testing and so on and so forth, and manage patients with sleep disorders.
Thank you so much. So you can start your presentation, and I just want to remind all of our attendees, remember, this is your space. We're doing this because we want to answer your questions. And actually the reason we invited Dr. Bola is because a lot of people have been asking to talk about a sleep disorder. So here's your opportunity to ask questions. This is like having your doctor at home. So please go ahead. Now we have the specialists, and we didn't even have to ask for an appointment. So let's take advantage of that. And Dr. Bola, the virtual podium is all yours.
Thank you so much. Okay, so I'm going to basically talk about a very broad topic, which is common sleep disorders. I'm going to try and touch upon, most of the common sleep disorders that we see in the community, but I'll be highlighting some of the more important ones. So I want to begin by just letting you understand that we actually spend 1/3 of our lives asleep. That's almost 8 hours out of every 24 hours of our lives are spent asleep. But what happens during that time that we're sleeping does impact our health during the time that we're awake. So bearing that in mind, sleep is extremely important. Why is it important? Well, sleep is important because this is when there's restoration and repair and healing of the body that takes place after, your day's worth of work and being on and everything else that we go through during the day. We're supposed to be repairing and healing the body. The toxins are being removed. Your body temperature is being regulated. Energy is being conserved. There are some hormones that are regulated during sleep, such as growth hormone is secreted during a certain phase of sleep, and that's why when sleep isn't adequate or isn't good quality or quantity, we see in children stunted growth. So kids don't grow the way they're supposed to. That's because growth hormone isn't released. Then we also see a decline in cortisol levels. These are our stress hormones. These are supposed to go down when we sleep. Our immune defense mechanism is in action during sleep. And then whatever we learn, so for example, I'm giving you this talk today, whatever you're learning and whether it's consolidated into memory tomorrow, it all depends upon how you sleep and how much of REM sleep you go into. So sleep really is essential to life and death. But when we talk about sleep, we're not just talking about the quantity of sleep, but also the quality of sleep. So what exactly is good sleep? Good sleep actually is 7 to 9 hours and continuous. So 7 to 9 hours. So remember that the average adult needs about 7 to 9 hours of good quality sleep to feel rested and productive and awake and alert the next day. We don't realize this because we live in a very sleep deprived society where we think sleeping 4 hours or 5 hours is normal. That is not the case. 7 to 9 hours is what we need. But then in addition to the in addition to the quantity of sleep, the quality of sleep is extremely important too. So, for example, sleep is good when it's deep sleep, and it's continuous. So the deeper stages of sleep would be stage N3 and REM, and it should be consolidated and continuous rather than fragmented. So if you're in a position where you're waking up multiple times at night, you could be sleeping 8 hours, but it won't be good quality sleep and you'll feel tired the next day. So what are the common symptoms of sleep disorders? Well, people could present with snoring. It's a very common disorder. It's a very common symptom of patient complaining that they snore, or their bed partner could be mentioning that they stop breathing, and that can be a pretty frightening kind of a feeling, that when you stop breathing at night, you could wake up, you could have problems waking up multiple times at night, and you're tired all the time, you're sleepy during the day, you're falling asleep at the wheel, or have other accidents because you just haven't gotten enough sleep. And then other patients could complain about difficulty falling asleep, which could indicate another sleep disorder such as insomnia. So difficulty falling asleep, waking up very frequently, waking up too early could indicate insomnia. Experiencing a discomfort or an uneasiness in the legs during the night could also be a symptom of a sleep disorder. And then some patients may report vivid dreams and dream enacting behaviors. So all of these are part and parcel of symptoms of different sleep disorders, and they often coexist. So what are the common sleep disorders that we see? So the common sleep disorders are obstructive sleep apnea, which I'm going to be talking mainly about. You may have heard about the term sleep apnea or obstructive sleep apnea, but then insomnia is extremely important, so is restless leg syndrome. And I won't really touch so much upon the other sleep disorders. There are almost like 80 or 90 sleep disorders out there, but narcolepsy is something that you see more in younger adults or in children, and it's not so common a sleep disorder, so I won't be talking much about that. There are some other sleep disorders that are called circadian rhythm disorders, and we see them in when the body clock is sort of misaligned, so I'll be talking a little bit about those. And then we could talk about sleep in the elderly, and COVID has certainly created a whole slew of sleep problems, which have to do with anxiety and depression and just related to COVID itself. So we could talk about that. And then lastly, sleep deprivation. We don't realize this, but if your sleep is okay, but you're sleeping only 4 hours, that is a sleep disorder by itself. It's called sleep deprivation. Okay, so we'll just briefly go over all of these. Just understand that the most common sleep disorder in the community is insomnia. So when patients present to their doctor's offices, they're typically presenting with, I have problems falling asleep, or I have problems staying asleep. So it's more symptoms of insomnia, and almost 30% of the population actually have this sleep problem. But when it comes to patients presenting to a sleep center for evaluation, most patients are presenting with symptoms of obstructive sleep apnea. Almost 70% of them have symptoms of obstructive sleep apnea. But the most common sleep disorder in the community is still insomnia. And then also understand that there are a number of factors that can affect sleep, such as pain can affect sleep. So if your body is hurting, or you got arthritis and you just can't get comfortable in any one position, that will affect your sleep. Anxiety and depression can not only cause problems sleeping, but a sleep disorder can cause anxiety and depression. So there's a bi-directional relationship between these mood disorders or mental disorders, anxiety and depression, and sleep. A very, very tight relationship where one can cause the other, or anxiety and depression can cause sleep problems. Medications, as we know, there's a number of medications that can either cause insomnia or they can cause sleepiness. So reading the label is extremely important because these can affect your sleep. Drinking alcohol close to bedtime or smoking or using marijuana can also affect sleep. Chemotherapeutic agents, patients who are on chemotherapy for malignancy treatment can also affect sleep. And then stress is extremely important in how we sleep. So if our mind is ruminating at night because of stress of the day, you're not going to be able to sleep well. So in essence, any illness, whether it's a pneumonia or Parkinson's or whatever it is, any illness can cause a sleep disorder, and any sleep disorder can basically cause illness in the body. So we're going to briefly talk about obstructive sleep apnea, which is really the one sleep disorder which we see very commonly in a sleep specialist office. A lot of patients are referred for these symptoms of obstructive sleep apnea and evaluation of sleep apnea. So most of the time, and this is not a hard and fast rule, but most of the time patients will present, they'll actually be brought in by their bed partner. So your common scenario is that a couple come in and the wife is concerned that the husband snores loudly at night and then he stops breathing, and that can be pretty scary, and she's concerned. She brings them in for evaluation. So snoring is a fairly common symptom of obstructive sleep apnea. Breathing pauses, these are also called witnessed apneas. Why witnessed? Because they're witnessed by a bed partner. Patient often reports that they wake up frequently, unexplained. They don't know why they're waking up. It's not that they have to pee often, but when they end up waking up, they end up using the restroom a lot. So frequent unexplained awakenings, waking up just feeling very unrefreshed, even though they're sleeping 7 to 9 hours, they're still very tired, feeling that you have a brain fog, that it takes a while for your head to clear in the morning, then falling asleep in sedentary situations like falling asleep in a meeting, occasionally drowsy driving, and accidents, which are a real problem, can also occur as a result of obstructive sleep apnea. And then because your sleep is interrupted so many times, you can end up with irritability and personality changes, and you're cranky all the time. Anxiety and depression can result from not sleeping well from obstructive sleep apnea. And we see that patients will often resort to stimulant use. This is a subconscious way of us trying to clear the brain fog. So, you'll go from drinking 1 cup of coffee to 3 cups of coffee every day, sometimes in the evening, sometimes at night. Smoking, because smoking stimulates your brain. Drinking energy drinks such as Red Bull or Soma, or even caffeinated sodas is not uncommon when you're trying to clear your brain fog. Memory and concentration can decline, and so can productivity. So we get a lot of referrals from neurologists where patients will present with memory loss. My memory's just been sort of going downhill for a while, and it's mainly short-term memory, and these patients have often gotten, a whole battery of neuropsychological testing, but in reality, the memory problems have to do with just not sleeping well. Occasionally, there is a link of sleep apnea to dementia, especially Alzheimer's dementia as well. Your sex drive can go down. Men can get erectile dysfunction. Their testosterone level can occasionally go down. And just in general, your quality of life is horrible. So as you see in the cartoon, this woman's trying to sleep. Her husband is snoring up the wazoo, and she's ready to pull the gun out of the picture frame. And this can cause marital discord. So when one bed partner is snoring really loudly and the other one isn't able to sleep well, and especially true in case of women are light sleepers, then it drives the couple into separate bedrooms, and that over time can cause marital discord. So bear that in mind as well. So one of the things that I recommend is to use earplugs, and there are two types of earplugs. There are the foam earplugs and the wax ones. The wax ones are the ones that swimmers use, and people, some people prefer the foam, but I think the foam earplugs actually work somewhat better. Um, and then just want to go over some of the risk factors for sleep apnea. So the risk factors for sleep apnea are obesity. So the higher your weight is or the body mass index is, the greater the chance of having sleep apnea. And also what happens in this condition, I have a schematic of what actually sleep apnea does, is you see here the tongue, and with sleep apnea, as the patient gains weight, their neck also gets bigger in size. So men will say that their collar size is now, they can't fit into the shirts that they used to be able to previously. So the collar size could get about 17 or 18 in size. Women, for example, who were able to wear that string of pearls previously, it just feels too tight now. Just gaining weight, not just gaining weight around your waist, but also gaining weight around your neck. And the tongue, believe it or not, has fat cells. So as one gains weight, the tongue and the soft palate, here is the tongue, and this is the soft palate. I don't know if you can actually see it, but the soft palate also has fat cells. So the soft palate gets longer, the tongue gets bigger, and these are muscles. And when we sleep, muscles relax. And when a bigger, fatter tongue and a longer soft palate relax, they are more likely to close off the airway. It's similar sort of in a way to, you sleeping and somebody were to like put a hand around your neck, except this is not happening from outside, it's happening from within. Your tissues are sort of caving in and closing off that upper airway. This is called the upper airway. And this is not a rigid structure, it's lined by muscle. So what really happens is that you have a drop in the oxygen level as you're sleeping because you're trying to breathe the air, whether you breathe through your nose or your mouth, you're breathing the air, but it's not getting past this obstruction. So the oxygen level in the body drops transiently. And this is a scary situation. This is when patients will start grunting and, choking, and the partner might say, "Oh, it looks like you stopped breathing in your sleep." But what this does is this drop in the oxygen will alert our brain. Our brain is a very, very smart organ. Our brain will sort of be alerted that something bad's happening, that you're having a stress response. And when that happens, the brain will not allow you to keep sleeping in deep sleep. It'll arouse you or awake you. So that's what results in these multiple arousals or awakenings. It's sort of a subconscious effort to sort of make you get the tongue out of the way by tossing and turning, by moving to your side, so the tongue is out of the way and the airway opens up. But there are two bad things that happen in sleep apnea. One is that these multiple drops in the oxygen level that happen night after night after night cause damage to the organs like the heart and the brain and so on and so forth, because all our organs need oxygen. So that's one bad thing. And the second thing is that those multiple arousals are brief awakenings. These multiple arousals are brief awakenings. They fragment our sleep. So as it is, we're a sleep-deprived society. We're not sleeping enough hours. But even if we were sleeping enough hours and our brain is arousing or awakening us so many times at night, you may be sleeping 8 hours, but it's sleeping 8 hours it's like sleeping 4 hours of good quality sleep. So every day that you wake up, you're like a zombie. You're in a state of sleep deprivation. So that's what is the other bad thing. How do you diagnose this condition? Well, number one, you would get a referral to see a sleep specialist who would evaluate you and have you fill out some questionnaires that sort of give us an idea of how severe your level of daytime sleepiness is and whether you snore or not. And then we would order an overnight sleep test, which is either done in the lab. We would book it for you and you would come and spend the night in the lab in the hospital. We have a 2-bed lab here at Nyack Hospital. And your insurance would pay for the study. Or we could order what's called a home sleep test for you, where we send you a some equipment, which includes a box and some disposable equipment, which you would actually place on yourself at night and then take them off the next morning and ship you would send the equipment back to the company. The home sleep test obviously is not as accurate because it doesn't really monitor sleep. So the in-lab test is most preferable, but it also depends upon preference, and it depends upon whether your insurance would pay for the in-lab study. And this is a tracing from an in-lab study where the red sections show that the patient who's breathing in and out, all of a sudden they stop breathing and the tracing becomes flat. And the green here shows that the oxygen level just drops. So this is obstructive sleep apnea. There are a number of devices that can be used for snoring, such as breathe right strips and chin straps, and there's a whole lot of stuff that's out there on the internet. But we're not talking just about snoring. We're talking about sleep apnea. Sleep apnea is the sleep condition that we worry about most. I mean, so a lot of people will snore, but not everybody who snores has sleep apnea. However, it is a very, very common symptom of obstructive sleep apnea. So how do you treat sleep apnea? The way you treat sleep apnea, the gold standard is with what's called a CPAP machine. And it is a sort of a machine that you would place at your bedside. It's paid for by your insurance if you qualify. It's delivered through a durable medical equipment company or DME company. They come and set this up for you at the settings that the doctor will prescribe. And you're sleeping basically with a mask on. It could be a light mask or a bigger mask, depending upon whether you're able to breathe through your mouth or nose or not. So this is really the gold standard. How does this work? It's not something that gives you oxygen necessarily. It basically gives you air under pressure. So instead of breathing regular air, you're breathing pressurized air. So that's how this works. And that pressurized air will splint open the airway and keep the airway open at night so that the airflow is constant and your body is getting the oxygen that's needed. And when the body gets the oxygen that is needed, it does not make you wake up several times and fragment your sleep. Okay, so that's called CPAP, continuous positive airway pressure, and there's also something called BiPAP, which is similar. But then there are other treatment options, and I've just sort of listed them over here. So this slide here is one of ENT surgery, ear, nose, throat surgery. So we could send you to an ear, nose, throat specialist who could perform a procedure, either, especially if you have a deviated septum, by correcting that could potentially correct some of the sleep apnea. Although I will tell you these are reserved mainly for patients who have mild sleep apnea, not severe, moderate or severe sleep apnea. And then the picture here is one of an oral appliance made by a dental sleep specialist. Again, a possibility. If you have mild sleep apnea, we could refer you to a dentist who also happens to be a sleep specialist to make this custom-fitted oral appliance. And then if you have mild sleep apnea, but it's mainly when you sleep on your back, we could order what is called a positional therapy with a sort of a belt that you would wear around your chest. In the past, they used to use tennis balls. And then essentially losing weight, and stop smoking, etc. These are all a given. Now, I don't know if any of you actually are CPAP users, but one of the leading manufacturers of CPAP machines is Philips Respironics, and their machines went on recall I believe it was last summer, due to some foam component which was defective, and that's created a lot of chaos where the machines in general are now on short supply. But I believe that Philips has started replacing the machines now, so the situation is getting a little bit better. Now, here is a form of treatment. It's called Inspire. It's been getting a lot of press recently. This is a surgical procedure. It basically looks like it's implanting this little metallic piece, which is nothing but a nerve stimulator, and it's implanted sort of like a pacemaker under the collarbone, and it requires a referral to an ear, nose, throat doctor who actually specializes in implanting these. It's called Inspire, and it's mainly meant for patients who have moderate or severe sleep apnea, not for mild sleep apnea, but for moderate or severe sleep apnea that happen to be CPAP intolerant. You have to be CPAP intolerant, meaning you tried CPAP and it just didn't work. So we could refer you to a center where an ENT doctor could actually evaluate you for implanting this. It's placed here right under the collarbone. Essentially, then you would sleep without a mask, without a hose, and no machine, but you'd have a remote in your hand. And at night, you would essentially turn the remote on, and that remote would then activate this device to stimulate the base of the tongue. So there's a wire that goes to the base of the tongue, and that stimulates the tongue to get the tongue out of the way. So this is another option. So every day we're seeing new and new treatment modalities for obstructive sleep apnea. It used to be that CPAP was the only thing available in the past, and there are a number of patients who just couldn't tolerate CPAP or they couldn't tolerate the mask. Although I'll tell you, the machines and the masks have become a lot more streamlined, a lot more easier to use now. So I think the compliance to CPAP has gone up quite a bit, but then you also remember you have other options now, which is a great thing. Okay, so switching gears, I'm going to talk about the next most important sleep disorder, which is insomnia. So really, insomnia is defined as difficulty either falling asleep or staying asleep or just waking up too early. And it can be either short-lived, meaning you've had insomnia for a couple of months or so, that could be acute insomnia, or you've had insomnia all your life. Like, for as long as you can remember, you've been a poor sleeper and you haven't had time, you just had problems falling asleep. Often describe their sleep as non-refreshing, but understand that insomnia is the term used if you have difficulty sleeping despite giving yourself adequate opportunities. So if you're putting yourself in bed only for 4 hours and you say, well, I have insomnia, well, that may not be the case. But if you're putting yourself in bed for a good 7-8 hours and you're only sleeping 2 or 3 hours, that you could have insomnia. And insomnia is often from another cause. I mean, it can be primary or idiopathic or chronic, but usually it has an underlying cause. So especially in short-lived or acute insomnia, there is a cause. For example, the death of a loved one or loss of a job. It's usually short-lived. Occasionally, you might need help with a sleeping pill, and then you manage to recover and the insomnia goes away. But depression and anxiety are very, very common causes of insomnia. And insomnia is sleep apnea is more common in men, but insomnia, on the other hand, is more common in women, and it's highest in women over 70 years of age. Excuse me. And this is a sleep diary. You can actually Google this from anywhere. You can just Google a two-week sleep diary if you wish to fill out one for yourself. And it's basically just a piece of paper with some grids on it where you sort of self-fill out, on a daily basis for a couple of weeks, and it gives you an idea of how your sleep pattern and your sleep duration is. And a lot of times your doctor may ask you to fill this out. There are different sleep tracking wearables out there to give you an idea of how what your sleep quality is like. Some people have Fitbits, and they'll bring in their smartphones and show me recordings of what the Fitbit is showing you, or other patients use apps on their phone to detect the snoring and whether certain interventions such as losing weight, etc., have made that go down. So there's a lot of technology out there, which again, you got to take. I'm not saying that they're not effective. They absolutely are, but understand they're not the gold standard. But they're very, very good for patients for tracking their own sleep. And so, if you are somebody who is somewhat, technology savvy, I would encourage you to use one of these to track your sleep. Most of the insomnia, as I said, has either a medical cause or a mental disorder cause, but a lot of medical issues can cause insomnia, such as acid reflux. A lot of times, the pain syndrome, such as fibromyalgia, arthritis. If your body is hurting, you're not going to be able to sleep. It's as simple as that. And instead of popping a sleeping pill, if your doctor treated the pain, then you would sleep better. So just bear that in mind. Lung conditions such as COPD can cause insomnia as well. COVID caused a lot of anxiety, and we saw a lot of patients presenting with insomnia secondary to the anxiety from COVID. And Basically, there are some medications that can cause insomnia, such as steroids. So if you're on prednisone, for example, just remember to take it in the morning rather than at night. Patients who are on beta blockers, such as metoprolol, those can also cause insomnia. So again, take them during the day. And then if you suffer from insomnia, make sure that you don't drink any caffeinated beverage after 12 in the afternoon or 2 in the afternoon, because caffeine has a long half-life. Read those labels carefully. Even sodas have caffeine in it. So try not to, if you suffer from insomnia, do not take any of those at night. Smoking close to bedtime is problematic as well, because nicotine is a stimulant. It'll keep you up. And then I think in our age, I think electronics is the biggest culprit. So using any kind of electronics close to bedtime, such as your cell phones or your iPads or any kind of electronics, will cause a delay in your sleep time, because your brain is trying to secrete melatonin at night. Melatonin induces sleep. We don't need to go to CVS to buy melatonin over the counter. Our brain is secreting it, but we need to allow it to be secreted. And the way to do that is to shut off the lights. If you turn all the lights off in your turn the lights on in your house as though it was Christmas, or stare at your phone, up until the time you're going to bed. Remember, these emit blue light, and blue light will decrease the secretion of melatonin. So be cognizant and put your devices away, or your television, at least half an hour or maybe even an hour away before bedtime. And then use that half or 1 hour before bedtime as a wind down period. Play some soft music. Don't watch a horror movie, because that's going to keep you up. Don't start paying bills. Don't mop the floor, just before you go to bed. I had a patient yesterday who had 11 cats, and he said, "Oh, I cleaned the litter at 12 o'clock in the night, and no wonder he can't go to sleep till 2 in the morning." So bear that in mind. And usually insomnia is treated, the best way is with cognitive behavioral therapy. It's delivered usually by psychologists, but they're hard to find. So a lot of patients take medications, but I think a lot of insomnia has to do with your sleep hygiene and just sort of cleaning that out and making sure that your bedtime and your wake up time is regular will solve a lot of the problems. But if you have to take some over-the-counter medications or prescription medications, those are out there. So commonly used over-the-counter medications are antihistamines, such as Benadryl or Tylenol PM. Just remember that if you're an older person, anything which has diphenhydramine or Benadryl can remain in your system for a long time and can leave you pretty groggy the next day. So try and avoid that. Melatonin is a relatively safe medication. It may not be very helpful, but it is a safer medication. And then there are a whole bunch of other, the shelves are lined with all kinds of sleeping pills, Unisom, ZQuil, but read the labels very carefully. Okay, and then here's a list of some of the FDA-approved prescription medications where you'll need a prescription from your doctor. So it really depends upon what your underlying problem is. I mean, if you're somebody who suffers from insomnia as well as anxiety or depression, you may be a candidate for one of these medications at the bottom, such as trazodone and Remeron. These are not actually sleeping pills as such. They're more of anti-anxiety and anti-depression medications, but one of the side effects is to cause sedation, so they can be used for that purpose. All right, so That's that. And then just switching gears quickly, and I'll just spend a couple of minutes talking about a condition, sleep disorder called restless leg syndrome, which is characterized by this discomfort or urge to move the legs. And it's mainly, it's either an urge to move the legs or a discomfort, or some patients describe it as a creepy, crawly sensation. Usually occurs in the evening or night hours, usually occurs at rest, and it usually improves with stretching or moving. And if that's the case, you may have a sleep disorder called restless leg syndrome, which can also fragment your sleep. It can prevent you from falling asleep, so it often mimics insomnia. So a lot of patients will go to the doctor and say, I have a hard time falling asleep, and they end up getting started on sleeping pills when actually they have restless leg syndrome, which is preventing them from falling asleep. So this is something that needs a workup. I'm going to skip narcolepsy because it's not so common. Circadian rhythm disorders. These are disorders where there's a misalignment between your body clock and the external influences. And I just want to talk briefly about delayed sleep phase syndrome. It's not insomnia. It's basically it's a sleep condition where you can't sleep before a certain time. It's like being a night owl, and you often see it in adolescents. And a lot of it has to do with just puberty and the fact that their schedules are so crammed, they've got so much of work to do, they're staring at their computer screens till late, that their bedtime keeps getting delayed and delayed and delayed, and before you know it, I can't fall asleep before 3 o'clock, I have insomnia. No, they don't have insomnia, because if they're allowed to sleep in, they will actually sleep 7 to 8 hours. So that's not insomnia. The problem, unfortunately, is that a lot of us have jobs, or we have to be in class or something the next morning where we have to wake up at 7 o'clock. And so you end up getting like maybe 4 hours of sleep. But it's not insomnia, it's called delayed sleep phase syndrome. I'm going to skip most of these, and so we're just going to talk briefly about sleep in the elderly. So basically, it's not so much a decrease in the need, but there's the elderly just are not able to sleep that much, and the reason for that is because they have medical issues like arthritis that will prevent them from sleeping well, or they're on a lot of medications. So it's not that they need less, it's just that they're not able to sleep as much. When you're not able to sleep as much, it can cause fragmented sleep, and it can be associated with falls, problems with cognition, and those are things that are real problems, because we worry about falls in the elderly, and they can often be caused by not sleeping well. We talked about COVID, that not only was there a lot of anxiety causing insomnia, but then also there was a lot of like delayed sleep phase syndrome with COVID, because everybody was at home. They were binge watching on Netflix, putting in extra hours on the computer while working from home, people were just getting less motivated to do anything outside of the bed, and they were basically not exercising, and they were just gaining more weight. There was more alcohol use and substance abuse, and I'm really hopeful and glad that we're emerging from the sleep problems related to COVID. I just want to leave you with a couple of things to bear in mind. There are a few things that are in your hands, and one of them is give yourself ample opportunity to sleep. Make sleep a priority. You must give yourself at least 7 to 9 hours in bed. You may or may not be able to sleep that, but at least try to give yourself that opportunity. Because if you don't, you're not even going to be able to sleep. And if you do recognize that you have a sleep problem, bring it to the attention of your doctor, who can then refer you to a sleep specialist. So I'm going to end there, and I will take questions.
Thank you, Dr. Bola, for that presentation. That was really comprehensive. So thank you so much. And yes, we do have a few questions. So let's start with this one. I get kicking legs right before I fall asleep. I'm on CPAP many times a night. I wake up with a twitching arm or flapping arms. I sometimes also thrash around. I don't know what could be causing this. I am on gabapentin for fibromyalgia and I take it at night.
So let me get this straight. I'm not sure if I heard that correctly. So is it somebody who's a CPAP user and they're thrashing around and they're on gabapentin for fibromyalgia, right?
Mhm.
So they're
And
thrashing
gets,
around,
and gets kicking legs right before sleeping.
kicking right. So I think it may be helpful to be evaluated for this condition called restless leg syndrome, where patients will kick and jerk quite a lot. And also make sure that your CPAP pressure is adequate, because you could be wearing CPAP for sleep apnea, but if your pressure is not adequate or it's not the right pressure, your sleep apnea may not be adequately treated, in which case you're going to be moving around, just trying to subconsciously open up the airway. But the kicking and jerking before the bedtime is often an indication of restless leg syndrome, and that's something that should be evaluated.
Mhm. The next question is, when should you see a sleep specialist as opposed to seeing your internist or PCP or trying to deal with the problem yourself?
I'm sorry, say that again. When should you see a sleep specialist?
When could you see a sleep specialist and not just your PCP or an internist? Like when should you really go to a specialist?
I'd like everybody to come to a sleep specialist right off the bat. That's what I think, because and you don't necessarily need a referral to come to a sleep specialist. You could call and make an appointment. A sleep specialist would actually have a better idea of some of the subtle nuances of sleep problems. For example, this is an example that I just gave you, is very often when patients have difficulty falling asleep, they go to their primary care physician, they often get started on a sleeping pill without trying to figure out what exactly is causing this problem falling asleep. Are they on a medication that is causing insomnia, or is it a restlessness in your legs, or is it some other issue? So I think a sleep specialist would have a better understanding of the I guess the root cause rather than of the problem. However, I think as a first step, if you wanted to bring your sleep issues to the attention of your doctor to ask them to refer you, that's fine too.
Mm-hmm.
But if you don't get a response, I would just make an appointment directly.
Mm-hmm. Thank you so much. Here is the next question. What is your opinion on weighted blankets?
What blanket?
The weighted blankets, those heavy blankets.
Okay. Yeah, so that is meant for what? So I've heard the term, but I don't exactly know.
Yeah, so I've only seen the commercial, and it's like these blankets that are heavy, and they're supposed to help you sleep better because they're heavy.
Okay, I'm not, like I said, I've heard the term, but I can't comment on it.
Okay. You mentioned sometimes, this is another question. You mentioned sometimes people have memory loss, which might be from poor sleep or sleep apnea. Would a sleep study help identify if there is a problem?
Yes, absolutely. Actually, we get a lot of referrals from neurologists for evaluating for sleep apnea in patients who suffer from memory loss, because it is a common side effect. It is a common consequence of sleep apnea. It's a known comorbid condition that's associated with sleep apnea. Mm. So before you embark on this big multi-million-dollar, neuropsychological testing, I think it's a very important question to ask: how are you sleeping? And do you snore? And do you have daytime sleepiness? Because if that's the case, your short-term memory loss could be from sleep apnea. Mm. And so essentially, what really happens is that with sleep apnea, because your airway is closing off multiple times and the oxygen level in the body is dropping so many times at night, the brain has these structures called the mammillary bodies. They're the structures at the base of the brain, and that is what actually consolidates memory. And those tend to shrink when they are exposed to low oxygen levels. So studies have been done with MRIs of patients who have sleep apnea with memory loss versus comparing them to normal adults. And they've seen that the mammillary bodies, which is what consolidates memory, are shrunken in size. And so when your brain is exposed to not just 1 or 2 days, we're talking about day after day and month after month and year after year, because sleep apnea is a chronic condition of low oxygen. The mammillary bodies tend to shrink and your memory is decreased. And also, when you have sleep apnea, you don't go so much into the deeper stages of sleep, because as you're trying to go into the deeper stages of sleep, it's like somebody choked you, your brain is not going to allow you to stay in the deeper stages of sleep. It's going to say, wake up, something bad's happening. So you never really go. So we notice that when we do sleep studies, patients who have sleep apnea, they have much less of REM sleep, much less of REM sleep. I mean, a normal adult needs 20 to 25% of their sleep is REM sleep. When we do studies on patients who have sleep apnea, it could be half of that, or sometimes none, no REM sleep, because it's deep sleep. And when you have less REM sleep, your memory again is affected, because it's in REM sleep that our memory is really formed or consolidated.
Thank you. What about having a nightcap to sleep better?
Okay, so a nightcap, no alcohol, please, right? But a nightcap such as what?
I'm not sure, but we'll ask the person who wrote this question to elaborate a little on what a nightcap is.
So I would suggest that whether you have a sleep problem or you don't, alcohol is something you should stay away from, because it used to be thought of, alcohol used to be the ultimate insomnia cure. It's like people thought, oh, I can't sleep, let me have alcohol. It will help you fall asleep faster, but it will wake you up because it gets metabolized and it can actually create havoc and can cause more sleep problems. And it can make the muscles in the back of the throat relax more than they should, and it can cause the sleep apnea. And you've noticed this, that when patients snore, the spouse will say, oh, he snores, but when he drinks alcohol, he snores like a freight train. So nightcap, if it's like a warm glass of milk or chamomile tea, that's one thing. But alcohol, I would stay away from. Alcohol, whether you have a sleep problem or not, try and stay away from alcohol at least 2 to 3 hours before bedtime.
Wow, that's good to know. And it was alcohol. So thank you so much, and thank you to Yandira for clarifying. More questions. More often, I seen TV commercials on smart mattresses for better sleep, stopping snoring, etc. Are they effective?
So, I mean, I can't actually advocate for any mattress or not, but the better, the firmer or the better your mattress is. A lot of the mattresses will now actually elevate the head of the bed as well, which does help if you have sleep apnea, because it opens up the airways better. I would highly recommend investing in a good mattress. What is a good mattress? That I don't know. That's a very individual thing. But if your mattress is not good, that's an environmental problem that you're not going to be able to sleep well. Your sleep environment has to be cool and dark, and you can't be sleeping on a really sagging mattress with tons of light coming into your room with the temperature up to 70 degrees. That does not promote good sleep. Good sleep means make it cool, dark, good mattress, no interruptions, no pets. No pets on your bed. You can't have like 5 cats sleeping on your legs. Because that'll interrupt your sleep too.
Sure. Jill is asking, my CPAP was recalled. I received a replacement about 8 months after the recall, have not been on a CPAP for that long or more. Philips has just announced another recall. What should I do?
Philips has not announced a recall for the machines, another recall. They've announced a recall for some of their masks now. So she should actually make an appointment and come and see me, and I can clarify a lot of those, or she should see her sleep specialist. So Philips announced a recall for, I would say, practically all their machines last summer. It happened last summer. It had to do with some foam component which was defective. And since then, and if she has registered her machine, which I'm sure she did, and that's why she probably had her machine replaced, right? She probably got a new machine. The new machine, it would probably be what's called the Dream Station 2, the number 2. That, to my knowledge, is not on recall. So she should be okay.
Okay.
But I'm happy to see her if she would want to make an appointment.
You were talking about vivid dreams and dream enacting. Can you elaborate on that a little bit?
Yes, so that can sometimes happen in a sleep disorder. Not always, but let's say you have a patient who comes in and says, oh, you know, I have these dreams every night, and they usually occur like in the second half of the night, and it's usually some bad dream where I'm being chased, or I'm trying to get away from somebody, or I'm fighting with somebody. Vivid dreams that are not necessarily pleasant dreams, but those kind of dreams. And then you start enacting those dreams, meaning it's like you're kicking and you're punching, and you can actually even hit your spouse. You can even hit your spouse in that setting. That can be an indication of a sleep disorder, which is called REM behavior disorder, and that requires an evaluation. And we kind of worry about that a bit because there can be some association with Parkinson's in the long term. And sometimes patients can also hurt themselves because it's almost like they're dreaming that they're being chased, and they will actually jump out of bed and hit their head. And
okay, it's 1 o'clock, Dr. Bola. I know you have patients and you've been running.
I do.
And we have a lot of questions today, and I so appreciate that you spent time with us. This presentation was phenomenal, and the fact that you answered all of these questions. So I thank you with all my heart. And next week, we're going to be talking about migraine. So for all of our attendees, and tonight we have an extra to talk about Medicare, all in Spanish. They're going to explain Medicare, 4 p.m. if you want to follow us. Thank you, Dr. Bola. Thank you to all of our attendees. See you next week.
Okay, bye-bye.